The veterinarian hears this history and they're like,
my goodness, this is probably diabetes.
Good morning, everyone. My name is Dan. I'm a veterinarian, and today we're going to go over diabetes in the cat and dog. I'm going to break down what a pet owner may see at home, how I as a veterinarian diagnose it, and how you're going to manage a dog or cat with diabetes long term. Okay, now here are a couple things that pet owners may notice at home. And you know what? I have a lot of people that roll into my office and they're like,
Dr. Dan, I noticed this, and this. I think my cat has diabetes.
You know what's crazy? A lot of times, these clients are right. A cat or a dog may do the following things. They may drink more and urinate more. This is one of the most common things that a pet owner may notice. Drinking and peeing more is caused by excessively high blood glucose. Because the blood glucose is so high, the glucose or sugar will kind of fall into the kidneys, which then pulls the fluid out of the doggy or the kitty, causing the pet to pee more. So, the glucose in the urine causes the cat or dog to get dehydrated, which causes them to drink more. Other things you may notice, and if we're talking about cats and dogs together, is weight loss. A lot of them will lose weight, and significant weight. If we're dealing with a doggy, you may see cloudy eyes from cataract formation from the elevated glucose. And with kitty cats, sometimes they're going to notice that their back legs, they have a hard time pushing off of them as well. So their back legs will kind of sink a little bit, and they're a little bit weaker in the back legs. The veterinarian hears this history, and they're like,
my goodness, this is probably diabetes.
So we're going to do two things. We're going to run some blood, and we're going to run some urine. On the blood, we're expecting to see an elevated blood glucose. A normal blood glucose varies a little bit with cats and dogs, but I want to see a doggy between, we'll say, 80 and 120. It can definitely fluctuate outside of that a little bit. But that's my goal. A diabetic dog will see numbers in the 4, 5, and 600 sometimes. That's super high and needs to be corrected. We also want to confirm the high elevated blood glucose with an elevated urine glucose. There should be no glucose or sugar in the urine. So, if we see an elevated glucose in the urine, we also can confirm diabetes with those two things. We get our diagnosis. We had our symptoms, which helped drive us down the path of doing some tests, which drove us into our diagnosis. And now that we have it diagnosed, we can treat the patient. Now, I'm going to focus on two things today. The two things I talk about with all pet owners is insulin and food. Insulin is the most important thing a pet owner will do for their cat or dog. The veterinarian will pick the most appropriate insulin, and there are a handful of different insulins. Based on the cat or dog's weight, they will dose out the quantity of insulin they want to give, and then in most cases, a pet owner will give insulin after a meal into the fat twice a day. This may vary in some situations, but after a pet eats, the blood glucose will go high, and then the pet owner will give the insulin, and that will drop it. So we're hoping to get a big spike, give her insulin, drop it down, give some food, it comes up at dinner time, give her insulin, drop it down. So the pet owner is giving 2 injections every 12 hours. The other thing would be a diabetic food. And the logic behind this is to help balance out the glycemic index. When the pet owner gives the insulin injections, the goal is to bring the blood glucose down after each injection. The food may provide a smoother line. So instead of spiking really high, hopefully we get just a little bit smoother curve so the blood glucose doesn't jump as much throughout the day. There's a handful of different formulas that you can pick from. Again, the veterinarian will pick the most appropriate option in conjunction with the insulin. Now that we started treatment, the veterinarian may do blood glucose spot checks. They may do a blood glucose curve to see how well we're regulated throughout the entire day. Also, fructosamine checks to check the blood glucose average over 3 months is also a good idea. Does a cat get really stressed when it's getting poked multiple times? Yes, sometimes we do. So maybe less poking with a fructosamine check every 3 months is a better option than a curve. I hope this was super helpful, guys. If you have experience with diabetes with your cat or dog, we want to share some fun facts or experiences, please comment below. I really appreciate it.